Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you to become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? Now, here's today's episode of the Gladden Longevity Podcast.
Hey everyone, welcome to the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and as always, we're here answering the big questions in life, like how good can we be? How do we make 100 the new 30? How do we live well beyond 120? How do we live young for a lifetime? And how do we develop a 300-year-old mind? In today's episode, I'm going to be talking with a gentleman, Joshua Ketner, who works at the Dream Body Clinic in Guadalajara. Not in Guadalajara, actually. He's in Mexico, but he's in Puerto Vallarta, Mexico. And he and his wife have started a clinic down there, really primarily devoted to the use of mesenchymal stem cells. It's a fairly short but interesting conversation about their approach, what they're doing, what they're not doing. I think you'll find it quite informative. Hope you enjoy it. Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I'm here with Josh Ketner today. Josh, welcome to the podcast.
Hey, thanks for having me on.
Yeah. So you're coming to us from Puerto Vallarta, Mexico, if I'm not mistaken, and you've been involved with regenerative medicine there in Mexico for some period of time. Do you want to give the audience and myself maybe a little bit of an intro as to how you got interested in this and how you got to be in Mexico?
Yeah, so I take it all back a little over 20 years ago. My dad had Lou Gehrig's disease, and with that, I just kind of saw firsthand how bad things can be for some of these terminal illnesses, what they will and won't do for you. Back then, they didn't have all this right to try stuff. So he had a big aerospace company, and he started doing his own research, and he goes, well, if you got HIV muscle wasting or, something like that, they're going to throw testosterone and growth hormone at you like you're a bodybuilder. And he asked for it, but up in Seattle, they wouldn't give it to him. I mean, not that it probably wouldn't have helped or anything, but we're just looking for anything. And it was frustrating. So after that, I caregived for him until he passed. And then I liked caregiving. I liked helping people. I started working for A Place for Mom. They're one of the largest assisted living groups in the United States, and helping people find a place for mom and dad. And read an article one day and it goes, hey, man outsources parents to India. That's genius, great doctors, low cost of care, not overregulated, but no one's going to go visit mom in India. And I was like, Mexico might work. And we had always vacationed in Mazatlan, Mexico every year. So I started looking into it, and I had a friend that had moved here to Puerto Vallarta. I moved down just to kind of see, because my job was work from home. Ended up meeting my wife. Her sister's a doctor. And, just kind of stumbled into this where I found out you can legally seek medical treatment abroad and return home with medication if you do all the paperwork right and everything. So we created a program where we could do that to help people, and then started hearing things about stem cells here in Mexico. But with anything, you got to be careful. I mean, there's a lot of overpromising and things that just, aren't real in Mexico and other places. So we ended up... Yeah, so my wife, she's Mexican. We dug in and we found a guy who did his PhD in cellular biology, University of Guadalajara, and started working with him. But we found pretty quick the quality control here isn't quite what you'd expect in the United States. So we had to go do our own thing, and we got our own biologists, got our own lab set up, all of that, and, had our doctors working with the treatments. And we just got this amazing team that does all that. And me and my wife, we just manage everything and, help people out.
Nice. So walk us through a little bit about what kind of treatments that you're offering down there, what kind of biologics you're using, that sort of thing.
So the main thing is mesenchymal stem cells. We take ours from umbilical cord tissue, the Wharton jelly, from placenta, and we isolate, then cultivate. That's the big difference of what we can do here versus the U.S. In the U.S., they have the minimal manipulation rule. They've got the homologous use rule, which means like for like. These things kind of get in the way of, really doing it the right way like we're able to do here. So it's mainly, number one would be joints, knee treatments, lower backs is probably the top thing. Then we do a lot of autoimmune diseases, and then a lot of chronic degenerative things like, hearts, lungs, livers, kidneys, that.
Got it. Okay. And so the programs that you're using mesenchymal stem cells. You're probably using other things in conjunction with that. Can you speak to that a little bit as to what kind of things get combined with that?
Sure. We don't combine a lot, really. For most of the treatments, it's typically just the mesenchymal stem cells. Maybe for like a hip or a shoulder, we might add some PRP. But the only other ones for brain treatments like stroke recovery, we might add some like cerebrolysine, which is a great group of peptides that, it's been approved in Europe forever. And I think because it's off patent, they never brought it to market there in the US. But yeah, those are the main things.
Okay. And so what does it look like for people to come down there? They come down and spend a week, they spend a day, what do they do? They spend a month with you? How does that work for them?
No, it's usually pretty quick because with our culturing process, we've constantly, like every day, we've got fresh cells coming out. We kind of have to estimate what we're going to have patient load per day, but we take them out of cultivation the night before and administer within 24 hours. So for like an IV treatment, it's a 4-day trip. Day 1, arrive and rest. Day 2, blood work. Day 3, treatment. Day 4, fly home. If they need an MRI, like for a joint, it's 5 days. So we have our own open MRI machine on site. Same thing, it's just we do the MRI and blood work on the 2nd day, review it with the doctors on the 3rd to make sure it's a good fit. We're very discerning with what we can and can't help, very honest with people on that. And then typically day 4, we do treatment.
Got it. Okay. All right. Give people an idea of things that you can't help. What would be something that you feel like, or some things that you couldn't really be that helpful for?
Sure. I mean, my dad had ALS. I wish we could fix that, but ALS, like Lou Gehrig's, doesn't respond. Parkinson's, we've seen maybe some really minimal reduction in tremors, but it really doesn't help there. And then for joints, it's usually things like they've got a bunch of osteophytes. If they've got like a complete tear of a ligament or tendon, they're not magic. They can't reattach things. They can't get rid of new bone.
Right.
So those are obstacles.
Right. Okay. What about payment? I assume this is kind of a cash pay scenario. Is that kind of how it's set up? I would think there's people are not bringing any kind of insurance along with them on this.
No, because like there's, insurance usually is only going to cover things that are like, at least there in the US, like FDA approved, all of that. Because of the whole way the system's set up, I don't think this will ever get FDA approved. It's a very big barrier to entry there, and you can't patent it. So yeah, it's cash. Sometimes if people have like health savings accounts, they can pay with those, but that's about it as far as insurance goes.
Got it. And then what about sources? What the sources for these mesenchymal stem cells you're talking about? What is the actual source? You getting it from placental or cord blood or?
Yeah, we take it from Wharton jelly and the placenta. So we work with a team of gynecologists that only work with first-time mothers. We're very careful with who we select from. The age of the donor is very important, their health. So they have to be between the ages of 18 and 25, first-time mothers. We need to make sure they're married. We ask how many sexual partners. And an MSC isn't going to carry a virus, but if the donor has a retrovirus, there's a less than 5% chance of carryover. So we need to screen the women, then the tissue, then the isolated cells and the cultured cells. Then we send it off to a third-party lab for further verification. And we provide all our patients with all the flow cytometry data, cell counter data, and that blood analysis.
Okay. All right. Interesting. Are there other therapies that you're looking at adding to the process down there, to the clinic, or are you pretty much settled into this, or what are your thoughts about that?
Yeah, I mean, we're pretty set into this. There's been some talk about like Muse cells. I don't know if you've heard about those at all. So the lady, I forget her name, but she's working with a friend of mine in Guadalajara that she was funded by Mitsubishi. It was for Parkinson's research, and They're starting up a lab there and going to start doing it. I don't know. I mean, the only study done on that has been for Parkinson's. There's a few places offering it that are, again, saying it's the cure all to everything. I'm not convinced. I've talked with her. I've talked to one of her partners who's a PhD from Argentina, and I'm not sure. Those apparently are going to be pluripotent and that they can turn into other things, where mesenchymal stem cells work via the paracrine effect. So, we worked with Dr. Arnold Kaplan in the past. He's who named them. And, they're not really a stem cell when they're in your body. They work via the signaling they do, sending out exosomes. And, he wished he could have renamed them medicinal signaling cells, but the name stuck. And so we call them stem cells. But there's things they're working on. We've looked into some of the induced pluripotent stem cell things, but, genetic editing gets a bit complicated, and just maybe in the future, but for now we're very set with what we're doing with the stem cells.
Yeah. Interesting. Cool. And then what about, how do people find you? How do they get a hold of you? How do people go about that?
I mean, most people will find videos we've done, interviews, different things, but our website has all the info. They're at dreambody.clinic, and it's got all the treatments listed. There's links to studies, tons of patient testimonials, things like that. It's all there.
Nice. Okay. Great. So Dream Body
Clinic. So it's
Dream Body Clinic. Okay. Got it. Any other topics you'd like to cover?
I mean, that's the main thing that we do. The stem cells, because we work a lot with growth hormone for adults. For kids, It's all FDA approved, all of that. But, I've personally been on HGH for 12 years and it does great they're finally doing some studies on that. If you look at the TRIM and TRIM-X studies, they're showing on the DNA methylation test it is turning the clock back. It's also helping regenerate the thymus, which is a big deal for your T regulatory cells. So it's getting some cool info there.
Yeah, TRIM and TRIM-X are interesting studies, right? So they're using growth hormone, DHEA, and metformin kind of in a cocktail, and they are showing some what I would call minor improvements in epigenetic ages and some rejuvenation of the thymus gland, which is interesting in and of itself because the thymus involutes as we age, and then you lose the ability to make more thymus cells, or T cells, if you will. So I think that's all very interesting. There's always a balancing act between growth hormone or any kind of adrenergic kind of hormone replacement therapy. And the reason is that if you're standing on the gas pedal of mTOR all the time, like bodybuilders or other people, yes, you build more muscle and bone, but you also die sooner and have a higher cancer risk. So there's really a balancing act between cycling into activating mTOR through growth hormone or androgens, and then cycling back out of it where you're activating the opposite side of the equation, the AMPK side, where you're actually rejuvenating telomere lengths and increasing autophagy and things like that. So it's kind of an economy of balance is the way we think about it. It's not about how hard can you push one side or the other. You need both, quite honestly, and you need them to cycle in and out. So yeah, that's how we tend to think about that. We're not fans of pushing anybody into a corner on anything, whether it's, being keto all the time or being on, mTOR activation all the time or AMPK activation all the time. It's really this sort of symphonic balancing that makes the difference. So interesting. Cool.
Yeah, no, for sure. I couldn't agree with you more there. I mean, that's the first guy I ever met doing it was actually a US doctor introduced me to it all. And yeah, low dose long term is where he said that's, more of the sweet spot. I mean, we've worked with some of the top bodybuilders in the world. And I mean, you see the acromegalia and other issues that they start forming. And if you go over 6 IU a day, you're going to give yourself type 2 diabetes, and they inject insulin with it. That's where it gets super dangerous. I mean, you hear about these bodybuilders, it would blow your mind how good their blood work is, even from all the steroids. But the insulin, it's like they don't even check their blood glucose, and they're like, oh, I did this dose yesterday, I'll do it again today. And you're like, oh,
right. Well, people don't realize that growth hormone, insulin, things like that, they're really connected. IGF-1, right? Insulin-like growth factor comes from growth hormone and then insulin itself. But both of those activate mTOR, and both of them actually increase cellular senescence.
Yeah.
So if you want to have more senescent cells, you stand on that side of the equation. If you want to prune those senescent cells, then you stand on the other side of the equation, right, where you've got AMPK activation and natural killer cell and CD8 cells working in your favor. So yeah, it's complex biology. And if you're listening to this, just realize that it is complex and it's not something to just wade into. You really want to work with somebody that can characterize where you are in the aging process, what you actually need or don't need, how much of it you need, and how often you need to be doing it, and what you need to be doing to kind of balance it out. I think it's a very sophisticated approach, really, to get it right. So we have a really healthy respect for it. It sounds like you do too. So, yeah.
Yeah, no, exactly. And I mean, I think that's like what you do with your clinic, right? You're helping people dial that in and put all the pieces together to make sure it fits right. So we see that. And like you said, the TRIM study is showing, I think it was like 1.5 years it turned back on the DNA methylation, where like the stem cells, I mean, we're seeing much greater like turn back before and after with like DNA methylation tests from stem cell IVs. So when people ask me, I mean, for a long time, it was growth hormone was, it had this myth of being like this anti-aging miracle. We were always very straight with people, like, celebrities use it, that stuff. But like you just said, it has to be balanced. And then, with the stem cells, we're seeing much, much better results. And
that's right. You can get bigger results with regenerative technologies like mesenchymal stem cells, other stem cells, exosomes, and plasmapheresis actually can give you significant reversal of aging as well. So there's lots of different ways to go about it. I think if you're listening to this, the key thing is to know what you need, how to go about it, how to time it, sequence it, dose it. And if you get that right, you can really reclaim your youth. If you get it wrong, you can really kind of screw yourself up. It's fire. It can be great, but you can also get burned. So just be very respectful of it. Yeah, good.
Definitely.
Cool. Well, thanks, Josh. I appreciate you updating us on what you're doing there. It sounds like you're doing some good work. So good stuff.
Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to gladdenlongevitypodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.